Well, history certainly warns us to be on our guard. As far back as the Middle Ages, the Black Death came in waves. So too did later outbreaks of bubonic plague. A century ago, it was Spanish flu that devastated populations. And while exact numbers are hard to come by, it's generally agreed that the second wave of the pandemic killed substantially more people than the first. Healthcare systems were, of course, not nearly as good as they are now, nor was medical or information technology. More recently, second outbreaks of dangerous viruses like SARS or MERS have by and large been avoided, partly because they were less infectious than COVID-19. But other big flu pandemics like the swine flu have had second waves. So what does that mean for us now? For starters, no two viruses are exactly the same, and no epidemics of infectious diseases behave in precisely the same way. But we know infectious diseases spread when people who have the infection come into contact with people who don't. An outbreak will continue to grow. Productive or R number, and keeping it below 1 is critically important, which is why measures such as social distancing and contact tracing will be part of all our lives for some time to come. We also need to know more about how long any immunity for COVID-19 might last amongst people who've already had it once, and we need to find out whether there's any significant seasonal variation in the way the virus spreads. Experts have warned of the danger of coronavirus re-emerging during the winter flu season in Europe and the United States, when health systems are already under huge pressure. They're also watching closely to see if the virus mutates to become more or less lethal. So there are a host of factors to take into account when trying to plan for a potential second wave. It's not certain that one will happen, and the early development of a reliable vaccine would be a game-changing moment. But until then, if mistakes are made when changing control measures, the virus could spread rapidly all over again.